My topical issue in particular is focused on the general issues and the lack of services for child mental health services across the country. For example, our primary care psychology appointments throughout the country now, there's over 6,500 children waiting for a primary care psychology appointment up to the end of May 2018. Some 1,700 of those waiting for over a year to be seen. And our child and adolescent mental health services are increasing. Almost 3,000 children are now waiting for a first appointment, over 300 of those waiting for over a year for a first assessment. This is an intolerable wait for children to see a specialist in terms of their mental health services. Their sister, if you like, services, the psychology services and the child and adolescent mental health services, which is our acute mental health services. And delays in one, no doubt, in community psychology services is leading to an increased pressure on our child and adolescent mental health services, the acute services. But unfortunately it gets worse. The number of children that are being admitted to adult units is increasing by 20%, so it has in the last year. This is where children who should not be in there, it is against government policy, are being admitted to inappropriate settings. But unfortunately, doctors and families are left with a Hobson's choice. Either get the services in an inappropriate setting or not get the services. And again, that is totally inappropriate. There is no multidisciplinary teams effectively out there to be able to support parents and children when they need help. And I look at my own county, for example, where there should be 3 consultant child psychiatrists. There are none. There are only 2 approved, but there are none for an entire county of 150,000 people. In child psychology services in my own county of Wexford, there are a 34-month waiting list and will not see any urgent cases. And the Minister promised last October a new site for inappropriate facilities that specialists are working out at the moment. Then it was promised for this summer. Now it's December, and what I've been told locally is the building is actually out for rent at the moment. Minister, you mentioned the number of CAMHS teams, but the vast majority of these are understaffed. You talk about the difficulty in getting psychiatrists, but the College of Psychiatry this year sought an increase from the HSE of a 10% increase in the number of training places. The HSE would only approve 5%. The government refuses to extend the National Treatment Purchase Fund to mental health services. The government refuses to appoint a Digital Safety Commissioner, which is critical to addressing the concerns that young people are experiencing online. Due to infighting between departments, Pathfinder, a crucial programme set up by this government, is not being financed so it can implement necessary supports for young people. Dr Kieran Moore from Wexford, consultant psychiatrist, left Wexford because Slaney House is not fit for purpose. He left after being there for 13 years. We were promised that the building was going to be a new building. Last October was promised, and it's still being promised, and it's still not being delivered. Children are distraught, parents are distraught, and it is simply not acceptable. Not enough has been done.